Today, we're going to talk about understanding your teen and understanding their depression. Now, when I work with parents who have depressed teens in my practice, one of the first things we need to do is really wrap our heads around what their teen is going through and wrap our heads around depression. Because until you can really firmly put yourself in the shoes of your teen and understand what it must feel like from their perspective, it's very easy to fall into some of these kind of parenting pitfalls that I often see. And the problem with these pitfalls, as we'll go through and look at, is that they generally lead your teen to feel very misunderstood. They can result in breakdowns of communication and can stall progress completely. So, the first pitfall that I see parents kind of fall into as a result of not understanding their teen and depression is the tendency to issue arbitrary consequences and punishments that don't actually remedy the cause of the problem. So, for example, declining grades are very common when you're dealing with depression. And if you just kind of arbitrarily take your teen's phone away to kind of motivate them or teach them a lesson, you may find that it makes no difference to the situation because it's not actually dealing with the cause of the academic decline. And another pitfall that I often see is what we would call fundamental attribution error. Now, fundamental attribution error is the general tendency that people have to attribute somebody's behavior to being a part of their identity, like a character flaw. So, for example, it's very common with depression to have it appear like your teen is very lazy. But if you start to identify your teen as lazy, they generally feel quite misunderstood and it can cause a lot of conflict. And if you think about it, on the days that you've felt lazy, there's usually a reason for that laziness to be occurring. Maybe you didn't sleep well, maybe you're overwhelmed with a task that's kind of just causing you to want to avoid and procrastinate. There's usually some sort of situation that's contributing to a lazy behavior. So we can generally see that in ourselves, but we have a harder time seeing it in others. And so we fall into this thing of fundamental attribution error when we start to identify a person according to their behavior. And the last pitfall that I often see is just parents unintentionally invalidating their teen. Often parents are very surprised to learn that their teen is feeling invalidated because they think that they're being very encouraging. They're saying things like, it's going to be okay, you'll get through this, things will be fine, try not to think about it, you're strong, this will pass, it's only temporary, right? Things that are meant to be encouraging, but their teen is like, what is my parent talking about? I don't feel like things are going to be okay. And I don't feel like things are going to get better. And I don't think that my parent gets me or what I'm going through at all. So often, words of encouragement are perceived as very invalidating by teens who are depressed. And as I said, these sorts of pitfalls result from a misunderstanding of depression and a misunderstanding of their teen, but can really cause damage to the relationship and to your ability to be effective as a parent. And that is probably, to me, the saddest part of all, because honestly, there is nobody in the world who's going to love your teen harder, fight harder for your teen than you, and who actually has the authority to make a significant difference in your teen's life. So, in my opinion, these are just pitfalls that we want to completely avoid. We don't want to be wasting time getting caught up in them. And so we want to really make sure we have an understanding of depression and your teen. And if this is resonating, please go ahead and consider subscribing to the channel, hit the like button and the bell to be notified every time I post a new video on the topic of parenting depressed teens. So I want you to, again, put yourself in the shoes of your teen and ask yourself this question. Why does my teen's behavior make sense from their perspective? In what world does it become kind of understandable that they might be inclined to act in this way? Not that you condone it, not that you're okay with it, but Again, once you can start to see things from your child's point of view, you're going to have a lot easier of a time partnering with them to make progress. So, as you kind of consider that question, I want to talk about what we know to be the cause of depression and some of the things that can contribute to an ongoing depression, as well as the symptomology and how that accounts for some of the behaviors that we generally see in teenage depression. So, there are known to be three causes of depression: psychological stressors, environmental stressors, and unmet emotional needs. What we know are not causes of depression, by the way, are things like a chemical imbalance in the brain, as well as genetics. So I say that because I often see parents spend considerable time worried about the chemical aspects of depression and really perseverating on things like medication. And obviously medication can be important in some cases, but it's definitely not a panacea. And you will make more progress, in my opinion, if you focus on the causes of depression as opposed to the idea that depression is the result of some sort of chemical imbalance. So chemicals can be affected because of the cause of depression. And if you focus on those causes, you'll make the most difference to the brain and the brain's functioning. Now, I also mentioned genetics. I think a lot of parents really feel a lot of guilt and shame, especially if they themselves have experienced depression and they feel like they've passed that to their kids. Um, we know that genetics do not cause depression. They definitely, add to a propensity. People who have kind of the genetics of depression uh, tend to be less resilient to these psychological, environmental stressors. Maybe more sensitive to these emotional needs than other people. But genes are activated by these three factors that cause depression, not the other way around. So, there are four types of psychological stressors that I really want to focus on. And the first is a perceived lack of control. Now, kids already don't have much control over their life, nor are they supposed to. They are not in the driver's seat. And because of that, it becomes especially important that kids feel a sense of safety: emotional safety, psychological safety, physical safety. And when these things are, ruptured or not had, it can be very psychologically damaging. So, when you think about things like bullying or abuse, childhood trauma, there's a reason why these things that occur, particularly in childhood, make a person more vulnerable to having problems across the lifespan. So, a lack of control, a perceived lack of control, is very psychologically stressing, and especially for kids, when that lack of control is coupled with feelings of unsafety, this is a huge psychological stressor. Now, another psychological stressor is a lack of predictability. And all of those examples from bullying and abuse and trauma that I've discussed have also inherently a lack of predictability present. But on top of that, you can be thinking about the importance of structure and daily routines, the importance of being able to predict one's day-to-day life. And when those things are absent, it's very psychologically stressful for a person. And another kind of lack of predictability is a lack of predictability in relationships. So, if somebody plays hot and cold, and they're very warm and loving to you on one day, and then the next day they're very cold and nasty, this is a lack of predictability that is very psychologically stressing. Now, another factor in psychological stressors is an insufficient, human connection. People are hardwired to connect. We're social creatures. It's very deeply embedded in us to connect for survival purposes. And so, when we are not getting real, sufficient quality connection, this contributes to a lot of psychological stress. So, the kind of sense of alienation and um, you know uh, being alone that people often feel, especially nowadays in the kind of culture and the world that we live in, People are very concerned about their to-do lists. We're very digitally connected nowadays, and all of this, of course, contributes to just a lack of quality connection. And along with that, you have a lot of unmet emotional needs, as we'll talk about. But a lot of those emotional needs relate to um, human connection. But the last category of psychological stressors is insufficient outlets for frustration. So, anytime that a person experiences a gap between what they want and what they've got, anytime that something's not working for us, we feel frustrated. You can even feel it physically in your body. And let's face it, frustration is not a very palatable emotion. It's not very socially acceptable. And so there's this general tendency to kind of mask, kind of shut it down. And if you think about the nervous system as kind of being like plumbing, your emotions, which are energy in motion, they need to move through the nervous system and flow effectively. They come in and they need to be released from the body. And so when there are insufficient outlets for frustration, when there are a lack of safety in one's ability to express their frustration in appropriate ways, of course, um, this sort of kind of clogs up the nervous system and its plumbing and can lead to a lot of emotional health challenges. Now, on top of your psychological stressors, of course, you have environmental stressors. So, family dynamics, school and what's happening there, friendships, interpersonal relationships, what's happening in the world, what's happening in your community. Even on a sensory level, some people are very, very sensitive to light, sound, touch. All of these kind of environmental stressors can contribute um, to depression. And as we were starting to talk about, unmet emotional needs often relate to a lack of human connection. Emotional needs, we get our emotional needs met through people as well as through engaging in things that we care about, feeling fulfilled in our life. So when we don't feel like we have proximity to those things and to those people, and enough of that, or we don't feel like people get us, we don't feel understood, like we fit in, if we feel highly judged, like we can't share our thoughts and our feelings, if we feel insignificant, if we feel like love is conditional, it's tied to performance, success, behavior. All of this contributes to a lack of emotional needs being able to be met and creates a lot of stress. So let's talk about the symptomology of depression so you can start to understand what it might feel like to be going through something like this for your teen. So, one symptom of depression is the experience of anhedonia. Now, anhedonia is the inability to experience pleasure. It's kind of like the whole world has become colorless. You're living in black and white. Everything feels indifferent. You kind of feel numb to things. And with that lack of pleasure and excitement, you also lose all of your drive and all of your motivation. Everything seems pointless. And we know that anhedonia does relate to dopamine levels declining, which can occur with depression. Dopamine is the chemical that is responsible for motivation and drive. It's the thing that kind of kicks you into gear. Anytime you anticipate something pleasurable, dopamine occurs, and it is the thing that kind of moves you to take action. And so, with that kind of being depleted and your inability to experience pleasure, there really is no why. There's no reason for taking action anymore. Now, what I do generally see clinically with my teens who are depressed is that as a result of this anhedonia and dopamine being low, their lifestyle starts to evolve around kinds of activities that are like dopamine inducing activities that require very little or no effort. So things like vaping, being on your phone, social media, video games, these are things that are like, you're like in this anhedonic state And you do these things because it kind of gives you a little bit of dopamine, or tries to give you a little bit of dopamine. And you can't really bring yourself to do something that requires considerable effort. So it's like these lifestyle activities are like a way of trying to experience pleasure, or just trying to distract oneself from psychological pain. What's interesting to know is that the circuits in the brain, called the pleasure circuits, are also the pain circuits. So you've got the pleasure and the pain pathway, but they're actually the same circuits. So when you lose this ability to experience pleasure, you gain this ability to experience pain. And so there's this kind of inner battle that can occur where you're trying to feel that dopamine, you're trying to get back to that pleasure pace, or you're just trying to distract yourself and not feel so much pain. And it can create this kind of lifestyle that starts to evolve, as a result of this kind of anhedonia that's occurring. Now, there's also the emotional symptoms of depression, feelings of sadness, guilt, shame. You may notice that your teen is crying a lot more than they ever did. For some teens, it doesn't present as crying, it presents as frustration, agitation, emotional outbursts. But underneath of all of this is just a real deep, dark sense of sadness and shame and guilt that, is occurring. um there's the shame and the sadness and the guilt that can be related to things that have occurred in the past that contributed to depression, or related to those stressors or those unmet emotional needs. Um, but then also, as a result of the depression and like sometimes the anhedonia, for example, there's this kind of reinforcing consequence that occurs where, now you start to feel guilty and ashamed because you feel like you're missing out on your teenage years. You feel like you're not measuring up to your parents' expectations, like you're disappointing them. You're embarrassed to go to school and face your teachers because you didn't do the homework. You feel like you're falling behind with your peers and falling out of relationships. So, all this emotionality that occurs, as a result of depression as well. Now, you also have the cognitive symptoms of depression, and there are a number of categories of cognitive symptoms. So, the first is, just an impairment of executive functioning. So, this is like planning, organization, time management, of course, task initiation. So, you walk into your teen's bedroom and like you can't see the floor. They've got clothes all over the place, there's stuff rotting in the garbage, it's smelly. They seem indifferent to it. You're in a state of panic. All of this relates to the executive function challenges. You also have memory, which can be, cognitively impaired with depression. So, yes, like memories from the past, of course, can be impaired, but also working memory. I've worked with a number of clients who, it's like you try everything to engage them in the session, and then you get to the end and you're like consolidating your learning. Okay, what do we talk about? What do we want to take into our week and try? And they just suddenly look at you blankly and they're like, what did we talk about for the last 45 minutes? And you're like, right? So working memory can be impaired, historical memory can be impaired. You also have, cognitive distortions with depression. So there's a general bias towards the negative. And in fact, a lot of research being done on this, that you show somebody a very neutral picture of something, and if they have depression, they just generally, the story tends to be biased towards the negative. And so, your teen is at school, they're walking down the hall, somebody doesn't make eye contact with them. There's this just general distorted thinking that, it must be me, there must be something wrong with me, or there must be mad at me, when really the person could just be caught up in their own little world. So, there's cognitive distortions about the world around them, and also distorted thinking about oneself. So, a lot of anti self thinking, a lot of self hatred, self loathing, you know, just my one client used to call themselves a parasite, if that kind of gives you a sense of how they feel about themselves. And of course, this is where you get these more dangerous, symptoms of depression, like self harming and suicidality. um, because there's this real like distorted thinking of oneself and one's abilities. There's a real underlying belief system that seems to be thematic with depression, and that's the belief system of I'm bad, I'm not good enough, I'm unlovable. And this can, of course, make life feel pretty unbearable. And what is also compromised with depression is the ability to do what we call reappraisal. So, reappraisal is the way that we kind of bring ourselves out of a negative mindset and all these kind of negative emotions that we can get stuck in. So, you can reappraise the situation and to be more objective, more positive. What can I learn from this? What can I do next time? You know, being able to look at things from multiple perspectives and reappraise is how we pull ourselves out. Well, when you have depression, reappraisal becomes very, very hard. So you start to feel like this is never going to change and you are just fundamentally bad and you don't have the ability to change. And so, the world starts to kind of close in on you, life starts to close in on you, and you start to feel like it's not worth living. Um, Also, the symptoms of self harm. Now, self harm is actually most of the time a coping mechanism for the struggle to reappraise. So you get stuck in this kind of emotionality and this negative mindset, and you can't find your way out. Well, when you self harm, it releases endorphins that kind of kick you out of that state. So this is why self harm can become very common with depression. Now, the last cognitive symptom you have with depression is the experience of rumination. So you can ruminate on the future, you can ruminate on the past, you can ruminate on all the ways you're bad, all the things that you're doing wrong, all of the, inaction you're taking or not taking. You can ruminate on all of this. And the interesting thing is, like, sometimes parents, they'll try and like scare their kid into taking action. Think about all the negative consequences that are going to happen if you don't start making some changes. And the kid is already ruminating on these things. They just can't seem to bring themselves to actually take the action. Um, so rumination can be very, very present. We do know that, again, as a result of these causes of depression, serotonin can be affected. The neurotransmitter serotonin, not that it's depleted, but that it's just not working as effectively. And this can result in a lot of these emotional and cognitive symptoms, we believe. So you have these aspects of depression. And then the last category is really the psychomotor symptoms and the vegetative symptoms of depression. So the psychomotor symptoms, the brain and the body just generally start to kind of slow down. Thinking becomes really slow and challenging. It takes a lot of effort. Of course, taking action is very effortful. It's just everything feels like you're climbing a mountain. You're weighed down by like 70 pounds of something and you're just walking around with. Um, and so you get these kind of psychomotor symptoms that are happening because the nervous system is kind of in this shut down sort of place. And that leads to these vegetative symptoms. So libido is shuts down, appetite can shut down, sleep is affected. You watch somebody on an EEG who has depression, and you see that their REM cycles are fundamentally different. They're not getting the same quality sleep as somebody who doesn't have depression. So all of these vegetative symptoms occur, and these psychomotor symptoms, these vegetative symptoms, are thought to be related to the neuronorepinephrine neurotransmitter that is depleted when you're dealing with something like depression. So that accounts for that kind of part of the symptomology. So I want you to kind of go back now and remind yourself of that question. Why might it make sense that my kid is acting this way? Not that I condone it, but in what world does it become understandable that this might start to happen? And hopefully, as you start to think about the causes of depression and how those causes can even become ongoing and create a vicious cycle, and how you start to think about the symptoms of depression and how those can become a vicious cycle, Hopefully, you're starting to gain a better picture of what it's like to experience something like this, and understand your teen a little bit better. So, once you have an understanding of these things, you want to start to help your teen feel understood. And you want to be having conversations with your teen to help you understand, what they're thinking and feeling and what it's like to be living in their shoes. And these are conversations that are not about solutions, advice giving. There's no judgment here. It's just really listening and, again, putting yourself in the shoes of your teen and making sure that you understand. And also, most importantly, that they feel like you understand. Because the next step from there is you can start to align with your teen, partner with them to take steps towards making progress. And you can start to come up with plans that are realistic in expectations based on the symptoms they're dealing with, and that your teen is kind of willing to partner with you around in order to do. Other things that you can be thinking about once you have an understanding is, how can I flip these psychological stressors on their head to help my teen feel like they have more of a sense of control over their life? And of course, partnering with them as opposed to making unilateral decisions is going to help them feel more in control. Creating structures and routines that provide a sense of predictability, providing predictability in your relationship and in your support of them and in the other supports that you can provide. Making sure that they're getting sufficient human connection, that you are spending quality time with them, and that you're finding other people and other opportunities for them to experience quality human connection, and providing healthy outlets for frustration. Trying to be patient with that frustration, very, very challenging. Trying not to be overly harsh or judgmental in response to their um, unhealthy ways of expressing their frustration, but trying to help them find other ways of getting their emotions out that are safe and appropriate. So these are other ways you can start to combat, the cause of depression. So if you found this video informative and helpful, again, please hit that like button. Leave a comment below if you have any questions. And if you're interested in doing a research call with me, I am currently in the research and development phase of a program that I have ongoing for parents called the Parent Led Depression Recovery Accelerator. So, this is a program that is already out there, and I am always looking to improve it in any way that I can. So, if you'd like to sign up for an interview with me, I'd love to hear more about your experience and what you're going through, offer any guidance and support that I can on our call in exchange for getting a better understanding of what you're dealing with, so I can make sure that I am providing the best program possible in providing solutions to parents who find themselves in this situation. And if you're looking for a community of support with other parents who are going through similar challenges to you, you may want to check out our private Facebook group, Parents Helping Their Teens Recover from Depression. We'd love to see you there. Until next time, take care.